Sorry, we are unable to complete your call at this time. Please try again later.
Well, yeah, that's what the text message I received today, 20 a.m. today, December the 1st, 2025, while I was on the phone with the Division of Administrative Law doing their little automated system 10-question thing. Saying that Louisiana Medicaid, we have not received documents, apostrophe yes, apostrophe, we need to determine your Medicaid coverage, upload documents today on mymedicaidla.gov. Well, I think this is what it sends you to, so whatever. Period. Call 1-888-342-6207. Did I not do 888-342-6207? Are they not in the office at 8:49 a.m.? Seriously? I have to wait 20 minutes for them to get into the office? This is ridiculous.
You have dialed a number that is not available from your calling area.
151T.
You have dialed a number that is not available from your calling area.
151T.
Alright, let's just put you. It's a number on the bottom, too. Right here, like on the bottom of the, and this is, I'm assuming, what they wanted me to upload is the Social Security letter I kind of got or printed from the website last month, even though it's a bit odd because I definitely have not been receiving $1,900 since 2015, so I'm not really sure why it's phrased that way, but this is just an auto-completed form. It's really there to show that I'm gonna be receiving that amount December onwards, which is this month. Should be the 3rd this month. I haven't received it yet, so I'm not pulling up a bank statement. Otherwise, I would have pulled up a bank statement. This is 2 days from now, and I wasn't having this issue with Medicaid on the 1st. I would have pulled up my Chase account and just shown it, and then just scrolled all the way down and shown a bunch of different months of transactions. I don't really give a fuck. I need this handled. I need Medicaid to not cessate itself due to like nothing other than some sort of technical error, because I'm clearly still receiving Social Security. So being denied based off of not receiving Social Security is stupid. And I've already called the marketplace last week, and I was just told to go to Medicaid, so I am. Because I'm not supposed to be off Medicaid. Even the marketplace plans itself, I found my original plan for my plan, says terminal illness is a qualifier for permanent Medicaid. So if that's where the money is put for people like me, then that's where I'm supposed to be. I'm not supposed to be on Medicare because under the marketplace, because I qualify under Medicaid, which is why when I tried to apply it on like the 27th, I guess, what was Wednesday? 26th of November. It just wouldn't let me continue to the plans. It allowed me to submit to Medicaid, and that was it. And I did. That's what I did. So yeah, and I mean I can show my other plans that I have up. Let's move this over here. I can show at the beginning. Yeah. My initial plan details and stuff. You can see it's not supposed to end 12/31/2078, obvious. And my first assigned primary care provider and the coverage type medical, whatever the Bayou Health plan is, I still don't know what that is, but that's what it said for each thing. And I just happened to print it and see it for this date. See, like I was 20 then, 28 now. Because this was from 2017, 11/20. And it's been quite a while. And so here is 2021, January the 21st. This first one was 2017, November the 20th. And this one is same thing, same account portal thing, remember details. And this is January 21st, 2021. And I don't know why I printed it for this date, but I was probably on the website for some reason. It was probably coverage stuff for appeals and the judge for the federal judge. We need something for her for the prior auths for the Adderall. Probably that. If like for the date range. Probably. Otherwise, I don't know. I don't know why I was on the account portal that day. I just was, and I just printed that. And so then you can see here, you can see, because I didn't, like, the effective date I started with, Dr. Linden was, clearly July 21st, 2020, so I don't think this is related to that. And the plan stuff didn't change. I mean, like, they added, like, whatever a rate code is. I think this is all the same. Well, maybe they changed some other stuff. Like, they added a rate group here and a rate code, at least for me to see. I don't know what those are. Wait. No, rate code's the same. Like, they added a second one. Whatever that is. No, the same member ID thing. Which I think this number, I don't know what these numbers are for, because I've never gotten a card or anything that shows any of those numbers. So these numbers are some internal thing. It has nothing to do with me. Essentially, they're probably nonsense, or some sort of a randomly generated thing for just this page for whatever reason, Oh wait, no, this is my member ID. It just is. It's not in one line, so I didn't notice the that part. Never mind. I think I've seen this on a couple of letters for the plan ID before. Is that the same for this? Yeah. The CQB, that's not filled in under anything. There's no intervention code for whatever HEDIS is. Wait, this says HEDIS here. Intervention steps. Needed medical service here. don't know what that is, all this, but they just small changes, I'm assuming, around here. And you see, like, this one says no copay, no copay, obviously. And the term dates, 2078. And this is, I was 23 here in January 21st, 2021. And here it's about a year later. Why did I say 25? It's more than a year later. It's a year and a half. Okay, so it's about 2 months and a half after my birthday. Right. Yeah. So I'm 25 here, and July 22nd, 2022. And this section for eligibility information, that's all exactly the same. And right here, all exactly the same for the primary care physician, PCP. And yeah, this all is up there, so it's all the same. And here you can see age 28. And if you look, my address is the same for the first three when I was 20, 23, and 25. My home phone number, still the same. No reason they shouldn't be able to contact me. It's changed here, but that's probably because of some changes, some issues with them contacting me for rides. So they just duplicated my cell phone instead of having separation, because some of the ride companies were only calling like the work number and instead of my actual cell phone, even though my cell phone would have been more reasonable when you're talking about taking a patient somewhere that's not like a building, so they're not going to have access to what would be like a landline or something. So I'm not sure why it was routing calls that way, but it was. So this seemed to fix it. So I haven't had problems because they changed that here. So that's a change. My address is different here, but it's been different for a while. I just don't know if I printed any of the member details things until like last month. And it shows my current primary care provider. Which I still see here, so I don't know why it would stay. There's like the end date here, I think, is the date for all this nonsense. So like 11/30 was the last date I had care, like last month, I guess. And it's 12/01/2025 instead of 11/30/2025. So it's that's why I'm doing this today. And I'm trying to contact Medicaid, but Medicaid's not answering. Medicaid sent me a text while I was on the phone with Medicaid's LDH's HH section to call them on the number that won't let me connect on either my computer or my phone. I might switch my phone's VPN around a bunch just to see if it allows me to force through. Because usually no one can just like hang up on me on my phone. That's really, really unusual. It's either they're just not turning their phone system on as a building. I've had that happen before. Because it might not be a specific time, which I don't think 9 is going to change anything. I'm thinking 9:30 might. Today's not a federal holiday. Yeah, the only times I've ever had anything like that happen has been if the physical building itself was offline, like completely off the grid, on purpose for some reason, like maintenance or something, like to where like they're not getting any work done because phones are going to be down just for them, and they probably like have to be at the office, and the doors are probably going to be locked. So they're going to be doing a whole lot of nothing all day, kind of a deal. Like I've encountered that a couple times. It's a weird like funding thing for state versus federal level stuff, with like saving money on, I don't know, electrical or something. And that would be looking at it in a positive light. Otherwise, I don't know what they're doing, sending out text messages or and posting on their website the a completely disconnected number. That's crazy. Like that's gonna screw our state over so bad. And I've never seen a provider type SEC. I don't know what that means. But that's, I guess, really recent. It shows that it's effective the same date that nurse practitioner trans has been to as my primary care provider. So same date, except this one doesn't expire until, the same 12/31/2078. And over here it shows a Bayou Health. Well, Bayou Health isn't shown. Okay, but Bayou Health plan down here is shown under the primary care physician. So I have a primary care physician details assigned to me in provider access health, okay? It doesn't mean Bayou Health itself doesn't exist anymore, but it says it's under, so like their network exists, but their benefit Bayou Health plan? No, it says Bayou Health plan there too, so it's the same string. And in the center part for eligibility information, or it's like center, like secondary part, it just added, and it added on top like another cell or something, like if it was a spreadsheet or something like that, to display a new rate code. So I didn't really look at this or scrutinize it very much when I printed it on November the 14th at about 13 a.m. I probably printed this right before I called Medicaid initially, just in case Medicaid, in case the portal timed out while I was talking to them on the phone, or in case they modified something that shut out my account access or something and I needed to like give them information. It was like both, more the latter than the former, because this part of the Aetna's account portal like did not time you out very expediently, probably because they assumed the member would be on the phone with Medicaid probably for a long time and not be able to easily switch. If I wasn't on my desktop, I would not be able to do any of this. My phone would crash and overheat just from me trying to speak to someone and having any tabs up in the background. And I know I'm not alone with that. It's just, there's too much that you have to do to deal with any of this. Here's the letter that I guess I received and stuff. I have it written here. Received on the 21st about the closed. But I learned about all of this on the 13th because of transportation telling me that I couldn't schedule out past the 18th, I guess, of November, even though the coverage obviously extended to the 30th of November. So transportation basically tipped me off to Meditrans to this, which is great. They allowed me to learn about this ahead of time, I guess, to start at least working on it somewhat instead of completely being screwed. And this, I guess I printed this first. So, like, this was from on Social Security's website at 7:49 a.m. on the 14th of November. And if I go, I'm probably logged out. Yep. Log back in. Okay, so let's take up the full screen, but you can see I uploaded these documents. I relogged into my account because it kicked me out. See if the fax number hurts my ears. Yup. So that works. Let's try their phone number again. Alright, if their fax number is up, I'm going to assume that, like, their system is up, probably.
Sorry, we are unable to complete your call at this time. Please try again later.
I mean, it's a very clear sounding automated voice system, so that's at least appreciated. Like, very, very clear. Like, I think only one of my side of my headphones was actually transmitting sound, and I was like, wow, that's much better than almost all phone systems. I can tell. I have no idea why they can't take my call though, so if I look at the bottom of the page, that should be up. Yep. So you can see here, this is the call, the thing I was calling. It's like whiting itself out. Here's the different phone numbers. 225-342-9500. Let's try that.
Sorry, we are unable to complete your call at this time. Please try again later.
Okay. It's a bit ridiculous.
Thank you for calling the Healthy Louisiana line. Your call may be monitored or recorded for quality assurance. For help in English, press 1.
Si necesita ayuda en español, marque 2.
You can always choose your health plan, find a doctor near you, request materials and forms, get answers to your frequently asked questions on our website at www.myplan.healthy.la.gov. or download the Healthy Louisiana mobile app in the App Store or Google Play.
If you are new to Medicaid and are calling to change your health plan or dental plan within your first 90 days, you must make the changes before 6 p.m. on Tuesday, December 30th, 2025.
To be enrolled for
Thursday, January 1st, 2026.
If you make the change after
Tuesday, December 30th, 2025.
you will not be enrolled into the new plan until
Sunday, February 1st, 2026.
if you are calling about Healthy Louisiana, press 1. If you are calling about
Healthy Louisiana Dental.
press 2. I have not received your to choose your Medicaid health plan, check your status, or change your Medicaid health plan. Press 1. For general information and frequently asked questions, press 2. If you are a provider or are calling for a provider, press 3. To speak with a Healthy Louisiana agent, press 0. To repeat, one moment while we transfer you to a Healthy Louisiana agent. This call will be recorded for quality assurance purposes. Information provided during the call will be kept confidential and only shared with the Louisiana Department of Health.
Thank you for calling Healthy Louisiana Enrollment Center. My name is Shatova. May I have your name, please?
Jeffrey Thomas Bodin.
I'm sorry, what was your first name?
Jeffrey, Jeffrey. Last name Bodin, Bodin.
Are you calling in on the behalf of...
No, I'm calling in on my behalf of myself. I'm the member.
For verification purposes, you will need to confirm 2 pieces of information on the case. May I have 2 of the following? Your Social Security number, date of birth, address, or Medicaid ID number.
436958926. And my date of birth 05/22/97.
And how may I help you today?
I just got a text message this morning about while I was actually in the middle of appealing, I guess, with the the DAL-HH section for the LDH on Medicaid or something. About Louisiana Medicaid not having received documents needed to determine my Medicaid coverage, and I tried calling the 342-6207 number a bunch of different times, and it keeps just disconnecting me on 2 different phones. So I was able to get through to you on a different number at the bottom of y'all's website, and I have uploaded new documents. I just want to make sure I talk to someone to have them check and make sure that I did upload the correct documents, because I got that text and I'm trying to follow up on it.
Yes, sir. So it showed that you are an individual that do eligibility. Your case was closed on November the 30th. With the Medicaid phone line, it is temporarily down at this time. They will be able to further assist you on the website, but by you turning in the information, I advise you contact Medicaid after lunch to see if they've received your documentation.
Like who it like Medicaid, like the number at the bottom of like the LDH's Medicaid site that I uploaded the documents, or contact like the United States Department of Medicaid and Medicare Services.
It's the Healthy Louisiana, the 1-888-342-6207.
Okay, so you think they'll be up after lunch or something, like noon or so?
Yes, sir.
Okay, all right. I will do that then. Thank you so much.
You're welcome. Is there anything else I can assist you with today?
I don't know. I guess just what, if you're able to see like what documentation it wants, proof of resource info. Do you know exactly what that is? Because I tried clicking around on the site to figure it out and I couldn't figure it out. I uploaded what I thought was it from Social Security, but I uploaded like my Social Security decisions and stuff from years ago. But that was like last month, and I'm assuming since they sent the text today, that wasn't good enough. I don't really have resources, so
Yes, sir.
I'm kind of, I just want to make sure I'm prepared before I speak to them later today, if I can.
Okay, so they will be able to further assist you on what information they need from you, and also provide you with the fax number to send or the email address to send it to.
Oh, okay. Then I'll just call them then. Yeah, no, I think that's all for now.
Please remember, at any time you can visit our website at myplan.healthy.la.gov. You may also use Louisiana mobile app to review the case status, update account information, find a plan, and locate a provider. Before you go, just to participate in the customer status survey about our call today.
Yeah, sure.
Thank you for participating. Please hold for the survey.
Were you satisfied with our overall service today? If yes, press 1. If no, was the customer service representative knowledgeable and helpful? If yes, press 1. If no, was the information we gave you clear and easy to understand? If yes, press 1. If no, was the customer service representative polite and respectful? If yes, press 1. If no, did recommendations from friends and family help you choose your health plan? If yes, press 1. If no, press 2. Did the health plan comparison chart help you choose your plan? If yes, press 1. If no, press 2. Did the health plan extra benefits and rewards help you choose your plan? If yes, press 1. If no, press 2. Did you change to a new health plan because your doctor no longer participates in your plan? If yes, press 1. If no, press 2. If you did not, would you like to get text and emails with health plan news, such as upcoming events? If you want to get text and emails, press 1. If you want to get text, would you like to tell us anything else? Please, press 1. Otherwise, press 2.